Esquimalt and Songhees First Nations. With that, I'm honored to introduce Dr. Bonnie Henry.
Thank you and good afternoon. For today's update, we have 55 new cases to report today, test positive here in British Columbia, bringing our total to 2,053. That includes 803 people in Vancouver Coastal Health Region, 918 now in the Fraser Health Region, 119 on Vancouver Island Health Region, 168 people in Interior Health Region, and 45 people in Northern Health. There are no new long-term care facility outbreaks today, and 12 now have been declared over. We have 391 cases that are associated with our long-term care facility outbreaks, and that includes 20 long-term care facility or assisted living facilities that are active currently, and 3 acute care units. Right now, we have, as people are aware, a number of community outbreaks as well, and the majority of our cases today come from the ongoing investigations in 2 poultry-producing plants, including 46 cases now associated with Superior Poultry, and that's the largest increase related to that today, and 34 cases related to United Poultry. We have an additional 2 people who have been identified, inmates at the Mission Federal Correctional Facility in the Fraser Health Region, bringing the total there to 120 inmates and 12 staff. In terms of our cases, we have 94 people who are in hospital right now in British Columbia, and of those, 37 are in critical care or ICU, and 1,190 people have fully recovered from COVID-19. Today, we unfortunately have another 2 people who have died from COVID-19, bringing that total to 105 here in British Columbia. And today is the National Day of Mourning. As you may know, this is a time to honor those who were killed, injured, or made ill as a result of workplace injuries. And we remember friends and loved ones, and we include a number of the people who are in our COVID-19 as well. We are reminded that everybody and how important it is to have good health and safety conditions in our workplaces, and that everyone deserves a safe workplace, as well as a safe home and a safe community. And the work that we're doing over these last few months reminds us of that. With this pandemic, COVID-19, our number one focus has been on protecting the health of everybody here in British Columbia. Every decision, every order that we've done, every restriction is based on that risk assessment that we have been doing, and focused on breaking those chains of transmission of COVID-19 in our families, in our communities. And we use science, and we've talked about that quite a lot, as much as there is science, and then we use our experience and the need that we have, the modeling that we've been doing, and the evidence that is accumulating from around the world on what's the best way to control this virus in our communities. That is an ever-evolving and changing thing, and you will know that our recommendations and the things that we have implemented across BC and, of course, across Canada and the world have changed as we've learned more about this virus. Currently, whether it's in the provincial ministries, returning travelers, or businesses, we absolutely recognize that the actions we have taken have significant social, financial, emotional, and health impacts on all of us. And we have been trying to use the data and the science that we have to find that delicate balance of making sure we have just enough restriction that we can control this virus, but enough that we can continue to function as a community. And we've seen that delicate balance, and now we're at that point where we need to find how do we translate that into our BC plan for our new normal in the coming weeks and months. It continues to be a whole of government approach here in British Columbia, and I provide with my team the public health advice and the health advice. But since I believe it was on March 9th when we announced that we were implementing the government pandemic plan, all of government has been involved. And the Premier will be speaking more about this and more about our plans in the days and weeks to come. We must all remember that this is the importance of the work that we're doing and the actions that we are taking together, and particularly the importance of these actions to protect our elders and seniors, as well as those with underlying health conditions that are at the highest risk of getting severely ill with COVID-19 and being in hospital. We must continue to protect them and to protect our families and communities as we're going through this transition period in the coming weeks and months. And we need to ensure the capacity and the tools that we have developed in our healthcare system, in our public health system, are ready to rapidly respond to any increases that we're seeing, and that the outbreak can be maintained over the next few months. More importantly, we can't lose sight of the role that each of us plays. So the decisions that we each make every day makes a difference to all of us in the coming weeks and months. The personal efforts and the public health measures are directly related to bending that curve, and we've seen that, and we've seen the actions that everybody is taking and how important they are. And these actions will form the foundation of the work that we're doing going forward. So things like washing our hands regularly, making sure we're not touching our face and eyes, environmental cleaning, making sure we're cleaning places, especially high-touch surfaces, our safe physical distancing that we've all been doing, and most importantly, of course, staying home and staying away from others if you get sick. These are the core tenets that will keep us in good stead, that will keep us safe moving forward, even as we increase our social connections and we increase our economic connections and we move forward in this pandemic together. What you do does and will continue to make a difference in the days and weeks ahead. And we look forward to sharing more details around some of the modeling that we're using and the details about our plans for going forward in the coming days. For now, we need to continue to hold this line and to continue to be kind to each other, to be calm, and to stay safe.
Thank you very much, Dr. Henry, and I wanted to join Dr. Henry, first of all, in reaching out and sending our condolences to the families of the two people who've passed away, one in Interior Health and one in Vancouver Coastal Health, in the last 24 hours. They and other families in similar circumstances have lost a great deal. It is a very difficult time to lose a loved one. It's a time when we're not able to come together as much as we would normally be able to come together and support one another. And so we want to reach out and say that every person is important. That has been at the heart of our response, of Dr. Henry's response, of everyone in the healthcare system's response, that everybody is important, and one that we continue to try and reach for at these difficult times. So we want to pass on again our condolences to those families. As Dr. Henry has said, we're now at 2,053 cases, 55 more today. It again underlines the serious nature of particular outbreaks, particularly the outbreaks in the poultry industry in BC that have affected us in the last week, such of the 55 cases reported on by Dr. Henry today, 39 are in the Fraser Health Authority, reflecting the situation that's gone on at Superior Poultry, and that tells us why we have to continue to be vigilant, especially in workplaces, to ensure that people are kept safe. As you know, there are 94 people now hospitalized with COVID-19 in BC. That's 50 in Fraser Health, 5 in Interior Health, 6 in Island Health, 3 in Northern Health, and 30 in Vancouver Coastal Health, for a total of 94, which is slightly down from yesterday. 37 in critical care, that's slightly up from yesterday. There's 4,115 beds available in BC. that are currently vacant as a result of the changes we've made. I wanted to note that yesterday there were 4,488 emergency room visits in BC, and that continues to be, of course, considerably down from the pre-COVID-19 period. There were about 6,550 on March the 9th, but considerably up from our low, which was just under 3,000 of 3 weeks ago, showing that people who need health care and who need emergency health care can go to an emergency room and get care, and that they are responding to our appeals to do so. I just want to provide a brief update today on personal protective equipment, on PPE. We're still keeping pace with demand for PPE in our health system. We've managed to maintain some supply from our traditional vendors, and our hard work to seek out new and credible suppliers has yielded some good results. I provided a brief update last Tuesday. You'll recall part of that update was 3 million N95 masks, respirators that had come to BC at that time, another 750,000 KN95 masks, and other supplies. Today I can tell you that since that time, since I reported last Tuesday, April 21st, we've received the following from vendors and donors: over 170,000 N95 respirators, over 350,000 pieces of eye protection, that's face shields and goggles, over 100,000 surgical masks, over 185,000 gowns, and almost 5 million pairs of gloves. As another key indicator of the success, since the start of COVID-19 in BC, we have not yet had to move to any alternative N95 respirators into use in our health system. This has given us the opportunity to secure a contingency of alternate sources from reliable and credible vendors, and importantly, to take the time to test these products for their filtration, fluid resistance, fit, and overall effectiveness. If the day comes when, and we expect it to, when we introduce those products, we'll know they're safe and effective, and we'll have had the time to make sure healthcare workers have the knowledge that they're protected and safe. I wanted to express my appreciation to everybody in healthcare, but in particular healthcare workers all across BC, from emergency departments to long-term care to ICU to assisted living settings, for doing your part to conserve and use PPE in an appropriate way. As always, you're keeping yourselves, your colleagues, and your patients safe. As you know, it was 3 months ago when we established the Provincial Coordinating Committee chaired by Dr. Henry and Stephen Brown, the Deputy Minister of Health, focused on protecting our most vulnerable, preparing our healthcare system to be ready for a surge, and providing the guidance that citizens, institutions, and employers can use to be safe. Our approach for flattening the curve has been to turn down the volume of our in-person interactions, where in some cases others in other jurisdictions have tried to press mute. And this is important, that our orders to completely close businesses have been very limited in BC. Other jurisdictions are making announcements this week to reopen businesses that were never closed in BC because of our nuanced response. This response allowed businesses to work with us to adapt and to innovate while protecting their customers and employees. Moving to a new normal will also be a partnership, with guidance from the provincial health officer and her colleagues, all of the medical health officers and the health authorities and all the people in the health system, of course, of how we can increase economic activity in a safe way. This is the way that British Columbia has acted in the beginning, founded in science, and it will still require a 100% commitment from British Columbians. It must balance the needs, of course, of our social and economic activity with our absolute need to ensure and to fight transmission of COVID-19. As the Premier has said, he'll be talking to British Columbians in the days and weeks ahead on how and when we can renew BC, reopen some activity in BC that hasn't been happening, and that's welcome news for all of us. But I want to say today, again, thank you to each and every one of you for being 100% committed to our BC fight, for staying 100% all in. Everybody who's watching today and everyone around you has helped save lives and keep people well in our province, and we are appreciative of your strength, of your courage, of your generosity, of your empathy. These efforts keep us all going. Renewing BC without rebooting the virus means our next steps must be the right ones for BC. And right now, here's something to consider. that protecting employees, protecting your employees on the business side, protects your business and protects all British Columbians. It's a partnership all of us can support and that we must support. So having committed to what Dr. Henry has asked us to do, and with anticipation about the new BC future we'll continue to build for ourselves, one thing holds true. We have to stay all in. We have to stay all in now for the ones that we love. We have to stay all in now for the ones that we don't know and hope to know. Physical distancing over time saves lives, and staying 100% committed to this gives us the best chance for all of us to have a better future. Aujourd'hui, nous annonçons 55 nouveaux cas pour un total de 2053 cas de COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer 2 nouveaux décès liés au COVID-19 dans les régions de santé de Vancouver Coastal et Interior, pour un total de 105 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Chaque région de santé de la Colombie-Britannique compte des patients atteints de COVID-19. 803 se trouvent à Vancouver Coastal, 918 à Fraser, 119 sur l'île de Vancouver, 168 dans l'intérieur et 45 au nord. Parmi l'ensemble des cas confirmés de COVID-19, 94 personnes sont actuellement hospitalisées, dont 37 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Thank you very much. We'll be happy to take your questions.
Thank you. A friendly reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question. I would also ask that you please unmute your phones. You will not be audible until I call your name. First question today is from Wendy Stewart, Globe and Mail. Go ahead, Wendy.
Oh, hi, Dr. Henry. Good afternoon, and thanks. I was just wondering if you could speak a little bit to the policies around admissions into long-term care. Is it known at this point whether any of the outbreaks that we've seen in BC can be linked or attributed to transfers or new admissions into long-term care?
Yeah, so we do have a policy of people, and you will recall that we decanted, as they call it, a number of people from alternate levels of care into, in some cases, long-term care, as well as transfers from the community into long-term care. And there is a policy that requires them to be on their own, to be isolated from others for 14 days after going into long-term care, to be sure that if somebody is incubating the virus, that it's detected before they have contact with others in the care home. So that has been the policy for some time. I'm not aware that any of our outbreaks are as a result of transfers into either from the community or from acute care into long-term care.
Next question is from Rob Shaw, Vancouver Sun.
Oh, hi, Dr. Henry. I was wondering if you could tell me, of the people who've recovered, the 1,190, how many of them recovered after staying in the ICU? And is British Columbia seeing the complications that are being reported in other countries with post-ICU patients who are having problems with their lungs, their heart, brain, their muscular systems, and even their liver and kidneys? Is that something we're seeing in our recovery cases here, or is there anything different about the cases that you've seen in British Columbia?
Yeah, so that's a really good question. I don't have the exact numbers, but I can tell you that our ICU case fatality rate, so people who've been in ICU and been on ventilators in particular, is much lower than that's been reported in other places around the world. And I actually had a meeting with some of our critical care leaders earlier this morning, and we were talking about some of these issues. So yes, we have seen a number of the complications that are being seen other places, including somebody who unfortunately died from a pulmonary embolus, so clotting of the blood we've seen strokes in some people. We've seen the cytokine storm that has been noted in some people. I can get the numbers on the survival rate. People who've been in ICU, there's absolutely been many people, including, I mean, we talked about this very early on, a woman in her 80s who was on a ventilator for a number of days, but then was released from hospital and home and is recovering. We have thankfully not had as many people in ICU as other places, so we may not be seeing all of the same complications that have been seen in other places, but I can get some more details around that for you. I will say that we have not seen some of the complications that have been reported most recently from the UK in children here in BC yet. We have very small numbers, and this bears out around the world. We have 5 cases in children who are less than 10 years of age, including an infant, and 14 cases in young people between the ages of 10 and 19. So we've had only one ICU admission, or one hospitalization, and no ICU admissions in our children. But we're obviously watching that very carefully, and particularly some of the issues that we're seeing arise in the UK.
Next question is from Binder Sujjan, CTV.
Hi, I'm just wondering, Ontario has put out some modeling done by an organization that kind of looked at data to estimate how many people may have been impacted by rescheduling or canceling and delaying surgeries, and it came up with 35 as the number. And I'm just wondering if you're hearing if BC is doing any of that type of work to look into those numbers to see what the impact would be. I think they came up with a number of 35 deaths, so just hoping you can comment on that.
One thing we are looking at and have been monitoring for some time is excess deaths in the community that are related to both COVID and other issues in the community. It's one way of doing surveillance to see if we're missing things in our communities, and that is something that we've been using in our day-to-day monitoring. The other thing that we are doing, and I don't have the data from that yet, is looking at the unintended consequences of the impact of all of the measures that we've put in place, whether it's on mental health, whether it's on whether it's on violence in the home, whether it's on other exacerbations of chronic diseases, and that would fit into that, as well as the impact on people having delayed surgeries. So we are doing quite a lot of work on that and looking at it by a variety of different measures, but we have not yet, I do not yet have the data to talk to that. I know in the plan for reopening of scheduled surgeries, that is something that's being taken into account. How long can you delay this surgery without probability of having adverse effects? So we can look at that in more detail for sure.
Georgie Smith, CBC.
Good afternoon. Can you, Dr. Henry, address concerns being raised about people going overboard in interpreting physical distancing guidelines? Do you think that some of the guidelines have been taken too literally and may have cost lives in the downtown east side, for example, due to people using drugs alone, for example?
Yeah, those are really complicated things, and particularly in some of those situations. I know early on there was a lot of how do we manage this in the best way that protects people who are more vulnerable, but as well as staff who are working at places like shelters, like the food banks. And I know there was some movement to close and consolidate food banks, for example, and move them in different areas. And we have been working with public health, has been working, and with a number of agencies at the front lines to try and address some of those issues. We have had occasional spikes in people overdosing, for example, and you're right, we were and are continuing to be concerned about people using alone. The other thing that has arisen, of course, and it's hard to tease these apart sometimes, is the toxicity of the street drug supply has increased dramatically as drugs have been importing of the drugs has been a challenge given international borders and all of the transportation routes being slowed down or stopped. So there's been a complex mixture there. And that is one of the reasons why we have developed, and it was announced on the weekend, the very ongoing plan to house people safely the tent cities that had arisen, a number of them, particularly in Vancouver and here in Victoria, had become very dangerous places for people for a variety of reasons. And so it's this is the initiative to ensure that people who are in those underhoused or homeless situations are put in places where they can be safe and where they can have access to meals, but also overdose prevention services in a safe way. So there's been a lot of modifications as well of overdose prevention sites and our supervised consumption sites and at shelters to try and ensure physical distancing, increased hand hygiene availability. And I will say things like our overdose prevention sites and the supervised consumption sites are very clean anyway, so, and they're quite amenable to putting in things like barriers and distancing. So there's been a lot of work done on that. I think early on there was a lot of confusion about how do we do this in a way that protects everybody, but I know that a lot of work has gone into that, particularly in our communities in the downtown east side and here in Victoria and across the province.
Keith Baldry, Global News.
Good afternoon. I know the hospitals are almost half empty right now, but for some reason, a number of nurses have contacted us saying they feel pressure to work when they don't think they should be working. They're not feeling 100%. They haven't tested positive necessarily. They just think that, and a number of them are very anxious about returning to work. Are there hard and fast rules or protocols in place in health authorities to determine what happens in situations like that?
Yeah, there's not hard and fast rules, but there are protocols, and absolutely we look at a variety of different things. There's some skill sets that are in short supply, and so it may be that people are asked to come in if they were potentially part of an outbreak, but we need that we can't provide safe care without that skill set or that person or that number of people there to support people. So I know in some outbreak situations, for example, people who are asymptomatic are asked to come in. We are all wearing appropriate personal protective equipment to make sure that there's no risk or that we minimize as much as possible any risk, both to healthcare workers, to each other, as well as to patients or residents. So it is a challenging thing, and it is on a case-by-case basis with your supervisor manager, and it depends on the situation in the unit that people are working on, whether they are needed on any particular day.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry. You said that you wanted to see 2 incubation periods pass before easing up on orders. So how much have the recent community outbreaks, namely at the poultry plant, set you back or have set back any hope that you have of lifting some of these restrictions as early as mid-May?
Yeah, I still think we're looking at mid to end May. I still want to see things going down, but these outbreaks are known outbreaks. And some of the other things that we're watching very carefully and that we're measuring around the province is those cases that we're seeing. As you know, we've expanded our testing again as we've moved into this phase to make sure that we're picking up anybody in the community who has respiratory symptoms that might have COVID-19. So picking up unlinked cases, or non-epi-linked cases is what we call them. So something is people who are sick without a known source that we can trace to very easily. Those are some of the things that we're watching very carefully. We still have a few of those, but most, as we're moving into this phase, most people are linked. So we're seeing people who are linked. They may be a household contact of somebody who worked in the poultry plant, for example. We know we've had household contacts of people who've come back from Curl Lake, who retrospectively we say, aha, that's where they got it from. So we can link people and trace people. That's the really important part, is being able to do that contact tracing very effectively and efficiently, and that's the work of public health. It doesn't set us back necessarily, but it is important for us. It's one of the indicators that we are watching very carefully, that we're ready to get to that place where we can start lifting restrictions and having more contact within of course, the core fundamentals of the distancing, the hand hygiene, and the absolute staying away and staying home when you're sick.
Nick Johansson, Castanet.
Hi, Dr. Henry. Just some more information about this death in the Interior Health Region. Do we know the age of the person, and was this person in a hospital when they passed, or were they recovering at home? And is there any indication of where this person contracted the virus from? Is it related to any of the outbreaks that are here in the IH region?
I'm sorry, I don't have that information today, but I can. We'll get that to you.
Next question is from Brishti Basu, Victoria Buzz.
I was wondering, are there any updates on when a serology test will be available in Canada and in BC? And also, you've touched upon this before, but can you tell us the framework for who is in line for having a serology test administered, and if there are guidelines in place to roll that out?
Yeah, so the BC CDC, this is one of those things where there's hundreds, and you've read about them around the world, and people are using them. They're doing different studies, and the challenge has been, and we talked about that a little bit earlier last week, I think, where some of the tests, for example, in Santa Clara in California, the parameters of the test are not that great. So there's both false positives and false negatives. So the BC CDC laboratory has been doing testing on 17 different types of serology tests here in BC, and there's a couple that are very promising. We had some discussions about them as late as last night, actually. And we are, one of the key things that we need to do is to be able to have people that we know have the disease and test them and see if their antibodies show up. So some of the people who have recovered from COVID-19 are in line to help us validate, as we call it, the test. And that's happening even this week. We have the protocols for doing that. And that's very exciting for us because that helps us understand where to best use these. The other things that we have in place are a research protocol, and we've already got samples of blood samples from people at different ages in the community that have been stored, waiting for a test to be developed. And that will give us a measure of how many people before this outbreak started, whether anybody had antibodies. And then we're doing another cross-section of the population early in May, because that gives some time for antibodies to be developed for those who have it. And we'll do it again in 6 months. And that gives us an idea of how many people in a random sample across the province might have been infected. So that tells us, the numbers of cases we missed. The other place that we have a protocol that we're developing is about as we go forward and we identify cases or clusters in the community, how can we use serology to see who might have had it and been missed in the past so that we can link people. So we're still working on that protocol. So I expect that we'll be able to use the test for some of these at least, within the next week or so.
Next question is from Dirk Meisner, Canadian Press.
Hi, Dr. Henry. Vancouver Coastal put out a statement today that they're going to start to implement the inner-city COVID-19 response strategy and based it on prevention, testing, and tracing people. How do you feel that's going to work in downtown East Side?
I think it's a great initiative. It's something that they've been working on. We have been doing enhanced testing and surveillance and monitoring of people in that community, recognizing that many people have a number of underlying health issues that would make them more at risk of having severe illness, and that if they are living in some of the communal settings that we've talked about, like the single room occupancy hotels or the shelters, that it can pass quite easily between people, both to staff who are working in those areas, but also between people living in the community. So I think this is a really important initiative to continue that and move it in the next stage, particularly aligned with the announcements around housing and ensuring that we have supported housing that has both, food and social supports and medical supports for people in the coming months and long term. So it's part of a strategy that's been worked on for quite some time.
Next question is from Richard Zussman, Global News.
Dr. Henry, on the outbreak at the Mission Institution and just generally around inmates, why was the policy not to test inmates prior to their release, and when did testing of inmates start? And for Minister Dix, On the vaccine side of things, do you expect that it will be rolled into the policies that exist now with schools to ensure that schools know when parents have vaccinated their kids for COVID-19, and is there any sense of making it mandatory for schools to have that vaccine?
Sure. So I can talk to both of those, and then I'll let Minister Dix talk to them as well. Sorry, and I've completely lost your first question. In terms of immunization, we have no mandatory immunization in the province, and I do not expect we will have mandatory COVID-19 immunization. We know that young people are less affected by COVID-19, but once a vaccine is available, we'll have a strategy to roll it out across the whole province, and it will be voluntary for those who want it and need it. Obviously, we'll be looking at people who it will protect the most, and at healthcare workers as giving healthcare workers protection to be able to support people who have the disease. And I'm sorry, the first
testing mission. Testing. Asking whether they got the test admission.
Oh, admission. I'm sorry. Yeah. So again, the outbreak was recognized somewhat late at Mission, and so it took some time to recognize that people had this and that COVID was being transmitted. And everybody at the Mission facility has been tested now, and that is our protocol that we've been using in long-term care home, for example, and actually at the poultry outbreaks as well. So people are tested, but we need to remember that a negative test is not necessarily helpful. So somebody who was exposed to somebody with COVID-19, if they're still within the incubation period, they could test negative today, but they could develop symptoms 24, 48 hours the next day or two. So it doesn't mean that we can stop monitoring and making sure we do health assessments on a regular basis, or stop isolating somebody who's been a close contact of somebody else.
Just on immunization, Richard, I mean, it was this time last year we were dealing with you'll recall, a measles outbreak, and a real effort was made by public health, by the extraordinary people who are doing so much of the work now on COVID-19 to increase especially the immunization of children and youth from measles and other immunizations that take place. And of course, one of our concerns in this period is that all of those people are working on COVID-19 right now. We're going to have to continue to ensure that people are immunized. As to the problem of a vaccine for COVID-19, I think it's fair to say that we would be delighted to have that problem, where people around the world are working on that, and I think the implementation of a vaccine regime will be very important at that time. As Dr. Henry has said, there isn't mandatory immunization, but it will be in public schools and in all schools in BC, mandatory registration to ensure that everybody knows, especially public health, knows who's immunized and who isn't. And we continue, and we will continue the extraordinary day-to-day work of public health in ensuring people are protected. And that will be the case if and hopefully when a vaccine is available on COVID-19. But I think all of us feel that we can, that we'll be able to work hard on that problem and resolve issues around that problem. The key with all of this is to not focus on a very small group of people who don't want to be immunized, but focused on getting the largest group who, of course, will want to be immunized. I think everybody in every part of the world wants to see a vaccine for COVID-19.
Next, we have a question from Farhan Mohammed, Daily Hive.
Good afternoon, Dr. Henry. Just a question on clarifying the number of recoveries. You said 1,190, which was the same number as yesterday. Is that to say that there were no recoveries in the past 24 hours? And also, is that one of the numbers that you're looking at in terms of that's going towards reopening the province?
Yeah, so you're right. There hasn't been no additional in the number.
I think the number's there, but
did I put the wrong number?
We'll include that in the statement, but I think it's 1231.
Oh, okay. I'm sorry, the wrong number I transposed onto my piece of paper, but it's 1,231, it sounds like, rather than 1190. So apologies for that. It is an important piece, but as you can tell, it's not a huge number. And we have been, because of the work that everybody's done here in BC, we have not had dramatic increases and large numbers of people infected. So what that tells us is we don't have enough people who are immune in our population to have that community immunity that we need to prevent transmission. So it is a factor. It's a factor that speaks to how prepared we were, the work that we all did to prevent transmission, and that people were able to recover from this virus. So it's not a factor necessarily that will help us know when we're ready to reopen connections where there's a possibility that transmission may increase again.
Thank you.
Mental and emotional health issues related to impacts of the orders and decisions around COVID-19. One of the animal rescue groups has approached us asking if the homeless people who are being moved from the street into hotel and motel rooms with supports will be allowed to take along their pet to their new location.
Yeah, so I know that is something that's a very important consideration for all of us. And, when we're in a time of crises, ensuring that our family and our pets are part of that very much. So there is provisions for pets, and it varies depending on the place and where they are. But it's also a consideration for where people might be placed depending on their needs. And one of those needs that is considered is whether they have a companion pet.
Okay, last question today. So for any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Dominique Levesque, CBC Radio-Canada.
Bonjour, en français pour le ministre Dix. Pouvez-vous nous parler d'un vaccin potentiel et comment il serait offert à la population?
Premièrement, ce serait un bon problème d'avoir pour tout le monde, n'est-ce pas? On est loin de ça et force est de reconnaître cela. C'est-à-dire que tout le monde dans le monde, je pense dans beaucoup de pays dans le monde, surtout en soixantaine, sont en train de travailler sur cette question. Et s'il y a un vaccin disponible, on va agir de la même façon d'actuellement, c'est-à-dire une façon scientifique, suivre l'avis de santé publique en Colombie-Britannique dans l'ordre d'obtenir le vaccin pour les individus, sans aucun doute. Mais écoutez, ce serait un excellent problème d'avoir. On s'attend à cela et on a des programmes actuellement des vaccins contre plusieurs maladies et il y a façon d'agir et on va sans aucun doute agir de la même façon avec un vaccin contre le COVID-19. Mais on n'est pas là, pas encore. Et donc, il faut travailler tout le monde dans le domaine de la recherche, dans le domaine de la santé publique, de travailler à fond, d'y arriver. Après cela, il y aura il y aura du temps, mais aussi il y aura un plan pour organiser que tout le monde qui en a besoin va recevoir ce vaccin. Merci beaucoup. Thank you very much.
Thank you.